So hello everyone and welcome to the case 33 of this case discussion series. Today we'll be discussing a very interesting case. So here we have a 24-year-old male who came with complaints of seizures since birth, and this is the MRI done for this patient. These are the axial T2 weighted images where we can see that there is extensive edema and hyperintensity in the white matter, the right frontal region, along with some cortical thickening in the paraphalcine region. These are the flare images where again we can appreciate this white matter hyperintensity along with cortical thickening, paraphalcine cortical thickening, the frontal region. These are the T1 weighted images where again this gray matter is seen very well, thickening of the cortical gray matter with blurring of the gray white matter junction. These are the T1 post contrast images where we don't see any abnormal enhancement of this paraphalcine cortical region, thickened paraphalcine cortical region. These are the coronal images, flare, where we can see this hyperintensity and edema. These are the T1 post contrast coronal images where we can very well appreciate this cortical thickening, focal cortical thickening with no post contrast enhancement. So this is the report I had given, the focal thickening of the right paraphalcine frontal cortex with blurring of the gray white matter junction with T2 and flare hyperintensity in the adjacent frontal white matter. There was no evidence of restriction on DWI or blooming on GRE sequences, ruling out any calcification or hemorrhage or any ischemia. There was no evident abnormal post-contrast enhancement that was observed, hence ruling out the possibility of any neoplastic etiology. However, there was subfalcine herniation to the left of approx 5 mm with effacement of the frontal horn of the right lateral ventricle. It was likely because of the postictal edema. Features were suggestive of a focal cortical dysplasia. What exactly is focal cortical dysplasia? So focal cortical dysplasia represents a heterogeneous group of disorders of cortical formation which may demonstrate both architectural and proliferative features. They are one of the most common causes of epilepsy and can be associated with hippocampal sclerosis and cortical glioneuronal neoplasms. The key feature is a transmantle sign typically seen in type 2 FCDs, where we can see that there is T2 and flare hyperintensity extending up to the ventricle, which is seen uh, from the cortex. It is variably associated with other features of FCD such as cortical thickening and blurred gray-white matter junction. In this case, it was not very well appreciated because of the intense white matter hyperintensity in the frontal region because of the postictal edema.